Hi, good afternoon. Can I just have your name and date of birth again?
Fabiola Cruz, 6/28/2005.
Okay, perfect. So Fabiola, we got your lab results, and I just want to let you know you tested positive again for chlamydia and gonorrhea. It says here that you've had it twice in the past 6 months.
Yes, that's correct.
Okay. It also says here that your complaint today is dysuria, pain upon peeing, and pain upon intercourse.
Yes.
How long has that been lasting?
It's been these past few days.
Okay. Is it like super severe? Is it like so painful, like when you go pee you were crying? And
No, but it is like disturbing.
it's very disturbing.
Yes.
Okay. So it says here that you're pregnant. Congrats, 10 weeks pregnant.
Thank you.
So it also says here that you took pregnancy tests 6 weeks ago?
Yes.
Was that the last any kind of OB care that you did?
Yes.
Okay. It also says here as well that you also forgot the medication that you were currently on.
Yes. Yeah, they had actually given me a medication, but I've tried to remember, but I just can't remember.
Okay. Well, that's okay. We're gonna probably try and see what the doctor says, and we'll probably get you something different. Okay. So I'm gonna have to assess your throat and your eyes and your head just to make sure, because gonorrhea and chlamydia, you know, they tend to infect the throat, the pharynx, the eyes, stuff as such. So I just want to make sure that, you know, nothing is so out of place that it's so abnormal.
Okay.
All right.
That's fine.
This is my friend Angel. He's my colleague.
Hello.
He'll be teaching you a little bit about the medications, and any other questions that you have would be pertaining to him.
Okay.
So yeah, please direct any questions to him. I'm just gonna assess you real quick. Just, you know, look through your hair and stuff like that,
Okay.
ears, nose, throat.
So here's what's going on, Fabiola. So it looks like we're going to be able to give you some antibiotics to help treat your infection. It's called azithromycin. Have you heard of that one before?
No. What is that?
So this is a one-time dose for antibiotics. We're just going to give it to you while you're here, and then we're going to be able to let you go, and we're going to give some checkups.
Okay.
So what's good about this one is that you were saying you had problems remembering your medications last time, but we're not gonna, this one is just one time, you're not gonna have to worry about that anymore.
Okay, and is it gonna affect my baby?
It should not, no. There shouldn't be any complications relating to the medication.
Would I still be allowed to have my baby naturally?
So if we're gonna be able to control your infection and get rid of it by the time you have birth, then you should be allowed to, but there are precautions that we need to take in case you do. There is a chance that if you still have your infection, we would need to do an emergency C-section to protect your baby.
C-section?
Yes. We're gonna speak to the doctor and try and figure out a good plan of care for you.
Okay, yeah, because I don't want to go through that.
I absolutely understand. But outside of that, are there any concerns that you have about your baby?
No.
Okay, well, that's good to hear. We're gonna have you come back in 4 to 7 days after we give you your treatment. We're just gonna check up on your infection again to see if it's working. And then
And what if it's not working?
we're gonna be able to start a new plan of care. We'll probably have to put you on maybe some stronger antibiotics, but hopefully it's gonna work. And if not, we can always speak to the doctor about going forward.
Okay.
But I wanted you to know that our primary care here is gonna be for you and your baby.
Okay.
After you come back, we're gonna see if it's going well. You're gonna come back again in your 3rd trimester, and by then the treatment should be effective and we should be able to be okay.
Okay, and so my friend, she also had the same thing. And never mind, he's already answered that one.
Okay. That's okay. Is it okay if I would be able to assess you real quick?
Yes.
Okay. Can you just look up, please? Say, thank you. Can you stick up your tongue? Tongue up. Thank you. Okay. Well, it's looking pretty okay. Like you said, I know you didn't want a C-section, but if if we do need to go forward with that, then we probably will have to.
Okay, and so is this something that I'm gonna have for the rest of my life?
No, this is something that is caused by bacteria, and we give antimicrobials. It's something that is reversible.
Okay.
The only thing that would stay with you is if it comes from a virus family like HIV or
Okay.
herpes 1 simplex and herpes simplex 2. So those would be the only cases of really it sticking with you for the rest of your life. But other than that, if the treatment doesn't work and the labs show that the medications aren't working, like Angel previously said, we'll talk to the doctor, we'll come up with a new care plan, we'll probably get you on stronger antibiotics, and we will keep on reassessing you until we make sure you're in optimal, perfect health for you and your baby.
Okay, and are they both the same thing?
They
Not
are
exactly, but they do often come together.
yes.
Okay.
But the good news is that even if we only detect one of them, the antibiotics we're going to give you should work for both. So.
Okay, okay.
Yes.
And then I had one more question.
Well, if you can't seem to get it right now, you could always come back and contact us another time, or even on the phone and ask your question. You can come and see your provider again if you have any more questions or any more concerns. Doors are always open.
Okay.
Always here to help you. So, was that it, Fabiola? Is that all your questions? Okay. All right.
Thank you for your
Thank
time.
you for your time. Have a good day.